Hi, I'm Dr. Claudia Kim, cosmetic surgeon here at New Look New Life. So today we're going to be talking about ProFractional Laser Resurfacing. This is a fractional erbium YAG laser treatment, and it's designed to resurface skin, stimulate collagen, and remodel the texture of the skin. So let's break that down. Fractional means that we're not treating the whole surface at once. Instead, the laser is actually creating thousands of tiny microchannels in the skin, and between those channels, we leave the healthy, untouched tissue. And that untouched skin speeds up healing and lowers the downtime. The ProFractional laser uses an erbium wavelength, so 2940 nanometers. It's absorbed by the water in the skin. This is a little bit technical, but that makes it very precise, and it ablates the skin and the tissue cleanly with very little heat damage to the surrounding area. And what happens next is that these microchannels trigger a healing cascade. So the fibroblasts start moving into the area, collagen and elastin are produced, and then the skin remodels. And because we're using an ablative laser, the surface is renewed as well. So this is where we see the improvements in the fine lines, the pigment, and the overall texture. So what can we treat? So ProFractional works really nice for acne scars and for the fine lines, wrinkles, and overall skin rejuvenation. And it also helps with uneven pigmentation and sun damage. How does the procedure go? Again, we clean the skin. We can apply a topical local anesthetic like a lidocaine cream. Sometimes we can actually do nerve blocks to like a dental block, or we can even give oral medication if we're going deeper, and you also have the option of going under some deeper anesthesia. Eye protection, obviously, then we use our settings, the depth and the density, and then we move the handpiece across the skin. Now, the recovery depends on how aggressive the treatment is. So if it's a light setting or a light level, just 2 to 3 days of redness and the flaking of the skin. If it's a deeper treatment, you can expect up to 5 to 7 days of the swelling, redness, crusting, and downtime. And as the skin epithelializes, the collagen remodeling continues for weeks and for months. Now, results. Many patients will start to see improvements after one session, but most will need about 2 to 4 sessions, and you space them out by a few months. And remember, results keep building even after the procedure. What are the risks? So most are temporary, which are the redness, the swelling, and darkening of the pigmented spots. There's also a risk of infection if you don't follow the proper aftercare. And in rare cases, you'll have scarring or long-term pigment changes. And with darker patients, we do have to be especially careful because post-inflammatory hyperpigmentation, or PIH, is more likely. How does ProFractional compare to the other lasers? So compared to non-ablative lasers, it is stronger, but more downtime, but bigger results. The scarier look, the better the results are. Compare this to CO2 lasers. The YAG laser does heal faster with less risk of scarring, but you do need more sessions for the same effect or the same tightening as compared to the CO2 laser. And where it really shines is in combination therapy. So ProFractional really works well with the broadband light, or BBL, for pigment and redness and veins, or with Halo for the hybrid resurfacing. And then you can always combine these with the PRP and the exosomes to really accelerate healing and collagen stimulation. So to wrap everything up, ProFractional resurfacing is really precise, customizable, and powerful. And it treats the scars, wrinkles, hyperpigmentation, and texture with much less downtime than the fully ablative lasers. It's really one of our best tools for long-term skin rejuvenation, and when it's done well, patients get smoother, healthier, and younger looking skin. I hope this really clarified the different types of lasers that are out in the market. Stay tuned for more educational videos like these.